Hello, welcome to another segment of Happy Home Marriage Talk Show. You know, it's not how big the house is, it's how happy the home is. My name is Adebayo Abletif, and today we shall be discussing medical screening and its importance before marriage. Specifically, we're looking at genotype. And today with me, I have Dr. Kudirat Hamzat, who is a consultant pediatrician at 44 Nigeria Army Hospital, Kaduna. Doctor, welcome to the studio, man.
Thank you very much, sir.
You're welcome. So, Doctor, as we all know that medical screening is very, very important before going into marriage. Please, what can you tell us about genotype and the importance of medical screening?
So, medical screening before marriage is very important. You cannot overemphasize the importance of medical screening because there are a lot of conditions around now that there is need for medical screening to be able to curb such conditions. And before I even go into down into genotype, conditions like HIV, like hepatitis, so as to curb the scourge of hepatitis and HIV in the community, there is need for us to have a premarital medical screening, so that individuals can be identified right from the beginning. There are lots of patients that are going around with HIV without knowing because it's not written on the face, and some of them might be asymptomatic. So because of that, because they don't present with symptoms, does not
Asymptomatic means they are not carrying the symptoms.
They are not presenting with anything. They are not sick. They are looking very well, even better than you and me. Because it's not written on the face, you cannot tell whether it is there or not. So if you do such screening, you'll be able to identify the individual, and as such, you can prevent and cancel those couples that are going in for such relationship to know what they are into. And genotype is described with genetic component of the individual.
Okay.
So the genetic component of individual as a genotype give you a blueprint of individual that makes me to be different from you.
From that.
And from everyone else.
Showing the gene.
Yes. Showing the gene at a molecular level before the conception of individual. So now going to genotype, because genotype, like we said, most of the time it's not genotype we are doing to identify whether you are a sickle cell, whether you are carrier, or whether you are AA. What we do in Nigeria is phenotype. Now the difference between phenotype and genotype, because we cannot do the genetic study.
Okay.
That's why we do phenotype, which is a display a good replacement
of
genotype that we have, that we can access easily. So phenotype shows in the laboratory, so the physical characteristics of those of hemoglobins. It's in blood group, we have hemoglobin. So I can have hemoglobin AA, AS, SS, AC. Those are different forms of hemoglobins that we can have. For those that have genotype hemoglobin SS, those are those that are called sickle cell. It means they inherited the gene S from both parents. Gene S from the mother and gene S from the father. Both parents are carriers.
Okay.
Both parents can be carriers. One of the parents can be a sickle cell, and the other, that's SS, and another one a carrier.
Okay.
In as much as there is S in their genotype, in both of them genotype, there's possibility of them having a baby or having offspring that have sickle cell. And then the risk of having sickle cell, as in a couple that are married, in a couple that both of them are traits.
Okay.
That's in both of them that they have trait of S. That's AS.
Yes.
The risk of having a sickle cell is not that when you have 4 babies, you have one child as sickle cell. You can be lucky to have all the children delivered as sickle cell because the risk is per each pregnancy.
Okay.
In one pregnancy, you can have A, you can have AS, you can have SS. So the risk of having AA in patients or in couples that are both traits, that are both carriers, they have 50% of having AA, 50% of 25% of having AS, and 25% of having sickle cell in a pregnancy. Okay. One can be lucky to have all of them as AA, one can be lucky to have all of them as SS. So that is where the problem lies, because you cannot tell whether the pregnancy you are carrying now is AA, is AS, or is SS until it comes out.
Okay, so
premarital screening, it is very, very important, and I don't think we should even start from premarital screening level before we go into we get people to know about the importance, about the risk, about the burden that is attached to sickle cell anemia. In the population. They said in the threat of sickle cell anemia in our population is 25%.
Wow.
So it is very common. And what makes it to be even more common?
It's more common in Nigeria.
It's more common in Nigeria, 25% say. And what makes it to be even more common is the practice of consanguineous marriages. Cousin marrying cousin. So it makes it to, because in a family you can have people that are yes. And then when you now practice the marriage of consanguinity, it makes it so easier for them to marry each other without even knowing, because they say it's we don't practice that much. We don't practice that much in this country, in our as Yorubas. That's how we don't practice it. But here it is very common.
Okay, Doctor, to cut it short, is it a misconception that people believe that when both couples are carriers, then the first one, using the mathematical population, I don't know how they calculate it medically, that the first one should be A and S, the second one should be A and A. Is it a misconception or?
It's a misconception.
Okay.
That was the first thing I said, that each pregnancy carried 50% risk of having AA, 25% risk of having AS, and 25% risk of having sickle cell. So you might be lucky as a couple not to have any, because each pregnancy is at each pregnancy, the risk is for each pregnancy. One can be pregnant now and have all of them as SS.
Wow.
We have a couple that they have 4 children and 3 of them are sickle cell.
Wow.
Both of them are traits.
Wow.
Not even considering when a patient with sickle cell is marrying a patient with traits. It even makes it much higher. It makes it much higher because we have a case now. The patient, the girl and the family, they know that the baby is sickle cell. Their girl is sickle cell. And when the husband came around, when the spouse came around, they told him, my child is a sickle cell patient. You know it, and everybody know. This thing is so hiding. But he said he is A. And as God will have it, the parents, they did not ask him to do another one. Now that is what I want to emphasize in this meeting, that nobody should tell you, especially for weak parents, nobody should tell you their genotype until you confirm it by yourself. Take them for a screening, get the test done in your presence, and get the result. Because a lot of things are happening around. When couples or when partners, when they get engaged and involved in a relationship, it used to be very difficult to break it. So it is very, very important for us to start right from scratch. Health education in primary school.
Okay.
And health education should be given to the extent of the brain of the individual at their level. Okay. So as they grow up, you continue the health education. This is what it has to do with genotype. Everybody should know their genotype. This is the importance attached to it. This is the risk. This one can marry this one. So that I can stop this scourge of sickle cell and the body that is associated with it.
Wow, thank you very much. Yes, well, this has been very, very interesting speaking with Dr. Kudirat Hamzat, who is a consultant pediatrician from 44 Nigeria Army Hospital. And this episode was actually sponsored by Arena News Kaduna. Thank you for following us. Well, the next question I want to ask, what other risk attached to the genotype screen aside from having either a sickle cell? Are there other diseases once you screen that genotype can actually open us up to? Aside from sickle cell, when we go for genotype, just sickle cell. Are there other risks attached to it?
There are other conditions, genetic conditions. There are other genetic conditions that the children are delivered with it.
Okay.
Such conditions runs in families. It runs in family. We have inborn error of metabolism. We have a lot of conditions. We have autism, a lot of conditions.
So can genotype explain or explain?
It's not genotype, because the way we carry genotype, I think it is only for sickle cell or for sickle cell trait.
Yeah.
No.
Okay.
Genotyping for any medical condition that is genetically inherited, or all those conditions can do a gene. We call it gene study. Okay. Genotype is a typing.
Okay.
It's a typing. When you want to type, even for blood group, it's a typing that you do.
Okay.
Because the antigen that is contained on the surface of the red blood cells that you check for blood grouping. So everything is genetic study is general. It's not just genotyping for sickle cell
So,
anemia.
okay, I want to bring you back to a particular question where you said, right from small, right from health education, we should educate our children so that they understand at what point now should prospective couples who are telling them themselves, oh, I'm going to approach a lady, or she's going to approach me, at what point should I start asking if we are AA, or should we start relationship first, or from the inception of relationship?
Okay.
For you to know if you are AA, or you are AS, or you are SS.
Okay. Right from the just as I said, right from primary school,
Okay.
every family should know the genotype of their children.
Okay.
And I will now know that I'm AS. Right from home, parents should be informing their children. You are AS, you know you cannot marry AS.
Yes.
So immediately everybody approach me as a girl, and that I know the importance of sickle cell, because right from beginning you have already been trained. There are a lot of issues with sickle cell anemia subjects. So because of that, I wouldn't want you to expose yourself not to get involved so that you will not land into such problems. So right from the beginning, you have been told that immediately somebody approach me, I'm AS. Please, can I know your genotype? Yes, I know what your intention, but please, can I know your genotype? You say it in a manner that in a respectful manner that it's not that you are accusing anybody and it's not you will not feel hurt about it. So you should know it should be a ticket before you can even start talking.
A ticket before anything. Yes. Okay, thank you very much. Does this genetic screening have anything to do with fertility?
Genetic screening does not have anything. With the screening test, it does not have anything to do with fertility.
Okay.
But because patients with sickle cell anemia subject, they have a lot of diabetes, they have a lot of issues associated with them. Maybe frequent getting sick in and out of hospital, frequent blood transfusion. Okay. It even affects their development. They have a form of delayed development.
Okay.
So for sickle cell patients, they may have some peculiarity that made their condition made them to have as regards their own fertility, but it's not genetic study. Okay. Genetic screen does not have anything to do with it.
Okay, thank you, doctor. Let me ask you before I go, for carriers now, AS couples.
It's not only AS as carrier, AC is also a carrier as a sickle cell.
Okay, but people know as AS.
They are the most.
Okay. Doctor, before we go, which one is more severe? Between AS and AC, I know SS already. Between AS and AC, which one is more?
There's nothing, it's not really much difference per se.
Okay.
But when the patient, the only peculiarity they have is in their complications.
Okay.
They have what we call retinopathy.
Okay.
It's a form of retinopathy.
Okay.
Proliferative and non-proliferative retinopathy.
Okay.
So those ones, they are commoner in sickle cell, CC or SC than SS.
Okay.
We have some peculiarity also with sickle cell with SS.
Okay.
SC patients, they also have more problem with toxemia of pregnancy than patients with SS.
Okay.
So they have little differences among them, but all of them are known to have continuous or ongoing immunity. Okay. That's why when you see their eyes are yellow. Because of ongoing immunity, destruction of red blood cells. The lifespan of their red blood cells is less than the lifespan of the adult red blood cells. That's the AA genotype red blood cell. Usually their own lifespan is 80 to 90. While the other normal AA blood is 120. So you can see the difference. Whether they have illness or they don't have illness, their red blood cell will get destroyed as soon as it reaches the 80 days of their lifespan.
Wow.
So that makes them to have high turnover. Their memory is always working. It's always working to meet up with a standard amount of blood cells that they will be able to maintain their life.
Okay, thank you, doctor. For couples or intended couples who are carriers and they know, what option do we have? Because I know there's this option of people going to test the pregnancy they are carrying, if it's either AS or SS, then they have the option of terminating the pregnancy before it gets older. How real is this test?
Yes.
How reliable is this test?
There are some tests that you can do in utero. That's before the pregnancy before the delivery of the pregnancy, let me
Okay.
say it. Usually they do it around 8 to 13 weeks of pregnancy.
Okay.
But such investigation to know whether the baby is genotype positive, I mean genotype A or AS or SS, in my own opinion, yes, there are investigation that they do. It has to do with taking a sample from the baby, under ultrasound guidance from the baby to test whether the genotype is AA or AS. Such condition, such an investigation procedure carries its own risk, has its own risk. Baby can bleed inside. They can even baby can even die even before you even diagnose. The procedure can cause IUFD, that is intrauterine death.
Okay.
So apart from that, when it is now confirmed to be SS, when the baby is confirmed to carry genotype sickle cell SS, the two traits, are you going to terminate pregnancy? How many pregnancies are you
want to terminate?
That's number one. Number two, knowing that even the fertility, everybody has their own threshold. Their own threshold. Who knows
How many do you know that
they are
they
going to have that will not start terminating pregnancies? That's number two. What is the ethic? They say the ethic says do no harm. Make sure that everything you do is beneficial to you and you yourself and the unborn child. And how many pregnancy will you terminate? And terminating the pregnancy, how do you know? Or being a sickle cell patient,
Does that mean
it's not the end of life. And it's not a ticket that you are dying.
Good.
It's not a ticket that you are dying. We have a lot of them that are professors now, and they are also attending their own.
Which of the children is coming with a very big destiny?
Yes. So I myself, because there was somebody that they wanted to do it. It is the condition. It is costly. It is not that it's without its own risk. It's not completely a no cost. So it's not something that we encourage anybody to do. What we are talking about, what we want people to do, is not to go into any relationship with trade carriers should not go into a relationship.
For viewers who are actually watching us, I hope you have taken 1 or 2 points there. If truly you love your partner, and you are both carriers of sickle, it's better you let each other go. There are other people there outside for you. The sincere love is by you, not putting that person in pain and not putting yourself in pain. We'll be discussing with Dr. Kudirat Hamzat, and it's very, very interesting. Doctor, right now at the moment, is there another cure for sickle cell other than bone marrow?
Other than bone marrow, because we said it's genetically, it's a genetic condition.
Yes.
And also a genetic condition, the only way you can you can cure it is by doing a genetic treatment. So genetic bone marrow or gene therapy, that is the only cure for sickle cell anemia.
Thank you. I want to get the last parting word from Doctor. Doctor, to our viewers, what do you want to tell them about medical screening? Just tell us something.
Medical screening, as when it is killed down to sickle cell anemia, it is a very, 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 very important. The importance of it cannot be overemphasized. Know your genotype. Know your hemoglobin electrophoresis. That's another name for it. Know your genotype, and let it be a ticket before you go into any relationship. You don't just tell me your genotype is AA or AS or whatever. We both go together and do it so that you have your result. Both of you see the result. You can be certain that this, yes, you are AA. We are not saying AS cannot marry. They can marry, but they should get married to a genotype individual.
Well, thank you very much. That's wonderful. Talking about genotype, I know those who are actually watching us, I know yes, we don't want this particular episode to come to an end, but maybe sometime we'll bring Doctor back to the studio so that we also talk more and deeper about other screening that are very, very important before we go into marriage. Like she already said, let your medical screening be the ticket to any relationship. You already know yours. What about the person coming? Go to the hospital together, visit the hospital and make sure you do your screening together. Don't listen to what he or she is going to tell you. I'm AA, I'm AA. Go there together, carry out the screening and make sure that you get the result. And again, addition, please don't rely on one result. You can visit 2-3 hospitals so as for you to be sure that you actually what they say. Okay, now we are into the social aspect of the program. And Doctor, being our guest, she's actually going to pick there are questions inside the marriage box. She's going to pick a question. We'll ask her and she's going to tell us the answer. Doctor, please pick from the marriage box. These are marriage box. Please, all
Bismillah.
the best. Okay, repeat. So, okay, and the question here goes, if your marriage was a song, what song will it be? What song will it be? Is it Titanic? Sing it, sing it, sing it. What song will marriage be? If it should be a song.
I don't know where I will put this one, but I will say a song to appreciate
To
God.
appreciate appreciation. Mo dúpẹ́ oníbù ọ̀rẹ́ bàbá gan pẹ́. Okay, for coming to our studio for answering our call, we are giving a late ticket to Doctor, this is a late ticket for Arena News in Kaduna. They have an office in Banawa, they have one at Mori Road. So you can go there and have your meal ticket. Sorry, I'm giving you two because the other actually brought you here. So this is one for Daddy and this one for you. Please say something to Arena Road.
Arena, thank you for supporting us. We pray that our relationship will last long.
Thank you, Arena Road.
Bye.